The Philippine Nurses Association of Nevada now brings you Philippine NARS, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Good evening, Philippine NARS listeners and followers. Thank you for joining us today. Well, today is a special day. Today marks the start of the third year that Philippine NARS is on the air. How about that? Our anniversary. We appreciate your continued support. We started this podcast with the goal of creating awareness of the different health issues in our community and beyond. And we have had so many wonderful guests that graced our program, and we have tackled many issues from homelessness to behavioral issues, from pediatric to geriatric problems. And your continued support, thank you again. We will keep up with this PNANV public service project. PNANV, of course, stands for Philippine Nurses Association of Nevada. And this is, of course, in collaboration with PHLV Radio. And today I have a co-host, none other than the newly elected president of the PNANV, Ms. Elizabeth De Leon Gamboa. Welcome, Lisa. Thanks for being here.
Thank you, Doris. Thank you for having me, and I'm happy to be here. So we have been in this COVID pandemic for a while now. Nevada has really done a great job in handling this pandemic. This is largely due to the medical leadership, the government leadership, and the cooperation of the people, our fellow Nevadans. Today, we at Philippine NARS would like to give you an update on how we are doing here in our community. And who better to talk to us about this other than our prestigious guest, the District Health Officer of the Southern Nevada Health District, Dr. Fermin Leguen. Welcome, Dr. Leguin.
Hi, thank you, Lisa and Doris, for inviting me to this program. Thank you.
Well, you're welcome. We certainly are honored. And we have a little bit of a tidbit about you, Dr. Leguin. So Dr. Leguin serves as the district health officer. He was acting for a while, and it's about time they made him the chief medical officer, the health officer of the Southern Nevada Health District. So we were really excited about that. And prior to accepting his position at the Southern Nevada Health District in 2016, Dr. Leguin served as the Medical Executive Director at the Florida Department of Health, serving the Miami-Dade, Pasco, and Hernando counties. He also served as the medical officer for Doctors Medical Centers, Inc., which is a primary care group in Miami. Dr. Leguin has been a consultant for the HWO and the PHAO immunization program in Jamaica and Peru. And he received his MD at the Havana University in Cuba and also completed his general preventive medicine residency and MPH at Johns Hopkins University. Wow, that is quite a mouthful. And do you have anything to add to that, Dr. Leguin?
Thank you.
All right.
Sure.
Okay. Lisa, you want to start? We're going to
All
ask you
right.
some questions.
Let's go ahead and get the ball rolling, Dr. Leguin. So can you give us an update of the current status and infection rates of COVID-19 in Southern Nevada?
Sure. Thank you for the question. Yes, as we know, this is already a year since we started this pandemic here in Clark County.
Mhm.
The total number of cases reported in our county is so far more than 226,000, and also unfortunately we lost more than 3,800 lives during this period. Of course, many families, friends, relatives that is one of us lost during this period. A lot of suffering in addition to, a big economic impact and social impact from the pandemic. Many families has lost the houses, people struggling to pay the rents, and a lot of people receiving assistance from the government so they
Mm-hmm.
can actually see the end of the month with proper food at the table and a roof. So there is a lot of suffering because of this pandemic. Uh, the good news is that besides the vaccination, what we have seen in the last six weeks is a consistent decline in the number of cases reported here in Clark County, and this is something that is happening nationwide,
Nationwide. Yeah.
and and also is something that is not primarily influenced by the vaccination campaign. uh, it's kind of a natural evolution of the pandemic. So what we are seeing is this dramatic decline. Like for example, the the rates that we are seeing today are almost half of what we saw 2 weeks ago. And for example, uh, something that we have to mention is that uh, even so there is a decrease in the number of of COVID tests that we are doing in the community today, perhaps a decrease about 30%. And this is something
Mm.
that is happening nationwide. Uh, what we see is that the positivity rate, which means the percentage of positive tests that are reported every day,
Mm-hmm.
has been declining since
Yeah.
early January. Today, our testing positivity rate is about 7.5%. Well, it is almost three times smaller than what we
Lower.
had at the end of December, beginning of January, when our testing positivity rate was between 20 and 22%. So it means that back in early January, uh, 1 out of 5 people tested will be positive for coronavirus.
Mm-hmm.
Today is only 7.5%, which is almost 1 out of 11 or 12 people tested. So they say it's a huge difference between today and
Definitely.
January. Uh, Another thing is that we have an electronic surveillance system to monitor the trend of the disease. It is called syndromic surveillance. We receive real-time information from emergency departments from local hospitals, and we look at people who has uh, what we call a COVID-like symptoms, which could be fever, shortness of breath, or other cough or other respiratory symptoms, and based on that clinical spectrum, we put them in in just one unit as COVID-like syndrome, if you wish, and we look at the trend of that. Well, uh, this is an indirect indicator of COVID activity in the community, and it is also consistent with the decline that we have seen in the number of cases. So there are several indicators that are consistent, telling us that the spread, the dissemination, transmission of the disease in the community has been declining consistently. Now, again, it wasn't initially influenced by the vaccination campaign.
Mm-hmm.
Right now, we have vaccinated here in Clark County. Oh, okay, let me rephrase that. We have administered in Clark County more than 420,000 doses of vaccine,
Uh-huh.
both first and second dose. Now, out of that, 288 doses are first doses. What it means is that today, uh, almost 14%
Yeah.
of people in Clark County have received at least one dose
One
of,
dose.
of
Mm-hmm.
COVID vaccine, which is great. And this, of course, is something that contribute to to help decrease the transmission of the disease. But again, that decrease started before the the vaccination could have a significant impact in our community. Uh, as you know, we received our first set of vaccines December 14, and that was Pfizer. Immediately, we
Mm-hmm.
start distributing that vaccine in the community. Right now, we have Pfizer and Moderna,
Mm-hmm.
and also we received notice from the federal government that at some time this week, we should receive about 17,000 doses of the Johnson and
Johnson and
Johnson
Johnson.
vaccine.
Right.
It's a very nice vaccine because requires only one shot.
Mm-hmm.
Allows you to move faster in the community, and
Mm-hmm.
also it's a vaccine that protects people against severe presentations and complications from the disease in more than 88% of the cases. So it's a great vaccine, and as have been mentioned by the federal government, CDC, FDA, right now we have highly effective vaccines available in our community.
Wow,
That's
that's great
great.
news. Yeah.
That's great news. And just as a follow up, you did say that the statistics have consistently going down before we even started, the vaccination. So does that mean that we were really handling this from a control standpoint in getting the community aware of what they should have been doing in order to prevent the spread of COVID? Do you think?
Well, I would say that we still need to be vigilant with
Sure.
this disease because again, it's a new disease, and we know I would say very little about the behavior of this virus. As you know, we already have two surges of the virus, one in the summer and again the beginning of winter. So our most important challenge right now is to be able to vaccinate as most people as possible and
Uh-huh.
as fast as possible, just to prevent transmission in the community.
Okay. Do you have a follow up question, Lisa? Or
So with that, we have these vaccinations already underway. When we're talking about the new strains of the virus or the mutations of COVID-19, will they keep changing like the flu strains?
yeah, because
Because you mentioned something about flu as well.
right, and on top of that, I was just gonna say that the UK strain is here in Nevada, and then there's the South African strain and the Brazilian strain.
Mhm.
What do you have to share about that, Dr. Leguin?
Sure, thank you.
Yeah.
Well, what we know today is that here in Clark County,
Mm-hmm.
we have confirmed 8 cases of the UK strain, the B11.7.
Mm-hmm.
Those 8 cases, all of them are doing well. None of them is admitted to the hospital, so they have a very benign presentation, and we don't have any fatality or severity from those 8 cases. But the message is that yes, that variant we know is already here. Uh, we have a surveillance system in place where our lab in partnership with the state lab in Reno, we look at the specimens, and if there is anything in the specimens that we receive that is not 100% consistent with the regular or original strain, then we are shipping those to Reno for further confirmation. In addition to
Mm.
that, our lab right now is in the process of implementing the technique to be able to complete the full process of variant identification here in Clark County. We already have the equipment and our lab researchers, they are right now in the process of setting up that diagnostic tool, which is great because it expedites the process of diagnosis. So far, we haven't received any report of confirmed cases of the Brazilian or South African
Mm-hmm.
strain here in Clark County. But again, we wouldn't be surprised if it shows up at any time because
Mm.
we already know it has been identified at other states across the country. But again, the most important thing right now is to vaccinate our community as fast as possible
Correct.
so we decrease transmission because by decreasing transmission, we decrease the possibility of having variants of those virus here.
Oh, good, good. Oh, okay. Let's talk a little bit about the vaccination status here in Southern Nevada. And you did mention a little earlier that something about 14% of our population has at least received one, dose of the vaccine. So like 14%. So, what are the current priority populations right now that need the COVID vaccinations? I think that was updated yesterday, wasn't it?
Right, thank you. Yeah, yeah, actually, last night we make an update in the what we call eligible groups. The the state of Nevada vaccination campaign has two parallel lanes. One lane goes by age groups, and the other one goes by occupational sector. So in the age group, we are now uh, working with those who are 65 years old and over.
Uh huh.
So yesterday, we expand our occupational lane to cover all all groups that from the public safety and security that was already there
Mm-hmm.
up to the frontline supply chain and logistics. That whole block. It includes what we call agriculture and food processing workers,
Mm-hmm.
also end-to-end essential goods supply chain, which includes manufacturing, transport, distribution, and sale of essential items. Also, we have in this block utilities and communications infrastructure.
Mm-hmm.
We have the Nevada Department of Transportation and local emergency road personnel. Also, we have frontline airport operations and other essential transportation, which is, Uber driver, those kind of things. So,
Mm, wow.
yeah.
Where do the casino workers fall on these categories, Doctor?
Well, the casino workers are not in this block. They are
Mm-hmm.
actually in the following block.
Mm,
Uh, but also the state is also working uh, with the gaming commission, and they're trying to develop a plan for casino workers that most likely will be brought up in probably in a couple of weeks or few days. But the casino workers are the next block
the next in
after.
line, huh? Okay. I'm sure my daughter is waiting for that one. That's good. Okay, so let's talk about the vaccination side. So I must say that I got my first and my second vaccination from the Southern Nevada Health District over in the Decatur area. And I'm telling you, it's very organized. And, we were not there very long. If you had your appointment, it was very smooth. So, did you have any experience like that, Lisa?
Actually, I did not go through the Southern Nevada Health District. I had it through my employer,
Oh,
and
okay.
we have our own clinics that administer the vaccine. So
Okay.
it was also smooth for us. We had our own schedules and all. So I was very fortunate to
Yeah, that's great.
have obtained it.
Yeah, I mean I really was very impressed. So does Southern Nevada Health District have control or oversight on these vaccination sites, doctor?
Well, I mean, we have our own sites, and also we partner with the county and local jurisdictions who they have the sites, they manage the sites, and we keep a very strong communication with them. We meet multiple times during the week just to go over the process, logistics, and issues that might come across or needs from the sites. And I'm talking about primarily government managed vaccination sites.
Mm-hmm. Mm-hmm.
So in addition to that, of course, we have all the hospitals here in Clark County. They they're receiving their vaccines directly from the state, so they can administer that
Their own.
vaccine to their
Yeah.
employees. So, and then there are other large healthcare employers that also receive direct shipment from the state, and they offer vaccine to their staff as well.
Mm-hmm.
In addition to that, we have the UNLV
Mm-hmm.
is a very strong partner. They manage a large site. They help us with vaccinating the community. They were actually our primary vaccine provider for the Clark County School District during recent weeks. So, I mean, there are a lot of entities participating on this.
Yeah, I just want to say that my husband is in that age group that I was able to get his first dose, and we went to Cashman Center, and that was extremely organized as well. And I must say, my hats off to those people. We had the military there, and they had volunteers from FEMA in there as well. My husband's vaccine was administered by a veterinarian who was a volunteer from DC. So I was really, it's really cool. I mean, y'all have to be applauded.
Yeah, yeah.
Thank
Yeah,
you.
I mean, I had to mention also that, of course, we we initially struggled a lot with appointments, as you might know, because when this vaccination campaign started, I mean, we weren't ready, like most people across the country weren't ready. We had to remember that this vaccination campaign started without initial federal funding.
Mm-hmm.
So we had to improvise from within. And
Yeah.
so because of that, we had to need to actually uh, create an appointment or registration system in-house to to address the issue and help our community navigate through that. That was really challenging for many people in the community,
Yeah.
and also, initially we didn't have um, a phone bank. So
Mm.
because again, there's a lot of people who are not technologically savvy to getting online and get appointment. For some people, it looks like a very simple stuff, but some others no. But we couldn't offer that phone service initially,
Mm.
and that created, of course, issues with access to the registration and of course the vaccine to segments of our community.
Mm.
We have been solving those problems. Today we have a statewide phone bank, a registration system that help the community get their appointments through the phone, and also they answer a question to the community regarding to concerns about the vaccine or other issues with COVID. And in addition to that, we are now in the process of implementing a electronic system statewide that is, I would say, more user friendly and stronger
Uh-huh.
than what we initially had. So things are improving on that regard, which is very important for the
Yes.
community, so
Yes.
everybody can have access to the vaccination.
Definitely. Definitely. Now, Lisa, I think you had a question to Dr. Leguin about the teachers and going back to school earlier.
Yes, this is a great concern about the kids K to 3 going back to school already. And of course, there are a lot of parents that are apprehensive about it, and even teachers themselves. They're like thinking, how do I get my students safe and not touching everybody or spreading the infection? So, can you shed some light and reassure our teachers and the parents as well?
Well, uh, what we know from other cities, jurisdictions, and even across the world so far is that the school system is not considered having a big role in disease transmission, in this case, COVID transmission in the community. It's different from the flu, where we know every season that as soon as the flu season start and children start coughing, everybody at home start coughing. Uh, with COVID, there are not reports of that experience. We also know that COVID in most children, if infected, is a very mild presentation for most of them. I
Mm-hmm.
emphasize most of
Mm-hmm.
them, and and then we have to wait. The impact of children missing one full year of school, social interaction and development uh, versus the risk of COVID, which again in the children population is very low, especially if we're talking about pre-K to third grade is the lowest among the school age children.
Very
Having
good.
said that, still the school system, whether it is Clark County School District, charter schools or private schools, they have uh, mitigation measures in place,
Mm-hmm.
whether it goes with the social distancing
Sure.
in the classroom, the use of facial masks, hand washing, and a lot of education with the children, and also the design in the school of how people flow through the different areas of the school. All those are elements that contribute to mitigate the risk of acquiring infection in the school system.
Very good. Very good. So you think that the teachers and the teaching staff should get the vaccinations prior to going back to the classroom?
Well, vaccination is not a requirement for
Mm-hmm.
teachers to go back to school, but it's one more tool that certainly will help protect them even more from any possible exposure. So, uh, the vaccination have been offered to all Clark County School District staff, whether it is teachers or support staff.
Mm-hmm.
And as I mentioned before, UNLV was our primary site for Clark County School District, but also Clark County School District personnel was vaccinated at all the sites here across the county. But again, uh, vaccination is not a requirement, but I will say I will strongly recommend teachers and support staff to take advantage of the vaccine that is being offered to them.
Yes,
Wonderful.
and it is available to the teachers and the teaching staff.
Mm-hmm.
Yes.
Mm-hmm. Yeah. Okay. Um, Lisa, let's see. What else do we have for Dr. Leguin?
So earlier, Dr. Leguen, you talked about the challenges of the community, the public, signing up for the vaccinations because of the technical issues, going into the website, all that. But I know that your group and your department has found ways to streamline that process. Now, you mentioned earlier about getting the vaccines. Have you had a lot of challenges obtaining them? Uh, because I know now we have a lot of smooth sailing vaccination programs already, and you've mentioned we're over the 400,000 that have been administered. So, can you comment on that?
Yeah. Well, the first thing I would tell you is that we have a struggle with vaccine allocation. Actually, we haven't feel satisfied with the vaccine allocation here in Clark County until the last couple of weeks. I would say the allocation have been small. We have been between 22 to 25,000 doses a week, which we consider small to this, to the size of this community.
Mm-hmm.
But now in the last 2 weeks, we are seeing a really a real increase in the number of vaccines allocated to Clark County, and uh, and we are now receiving somewhere between 50 and 60,000 doses a week, which
Wow.
help
Yeah.
us expand into our community. But again, initially it was a challenge, and again, I don't blame the state because the state can only uh, give give to us what they receive. So it
Correct.
was a matter of the federal allocations through the state.
Okay. All right. People are having various reactions to these vaccinations, the Pfizer and the Moderna. And now the J&J Johnson & Johnson vaccine has just been approved. And people are wanting to know which vaccine to take based on maybe age or medical conditions or the severity of side effects. Can you comment on that, Dr. Leguin?
Yeah, sure. Yes. Uh, well, we know that the efficacy from the clinical trials from Pfizer and Moderna was somewhere between 94 and 95%. The efficacy from JJ in the United States, Johnson and Johnson clinical trials, was about 72% efficacy in the United States. Uh, Something important about those numbers is that uh, is we should not compare those vaccines by those numbers because the situation, the elements that contribute to that efficacy
Mm-hmm.
at each of those trials was very different. At the time of the pandemic, that each of those vaccines was studied,
Right.
but it's something very positive about the Johnson and Johnson vaccine, which goes beyond that 72% efficacy that we know that, which by the way, any vaccine with 70% efficacy is a great vaccine.
Mm-hmm.
But is that this Johnson and Johnson uh, actually prevent uh, 88 to 90% of severity, hospital admissions, and deaths. So, and that's where the real value of vaccination is preventing severity and death. And Johnson vaccine has shown that they have that in their favor, which is actually consistent with the other two vaccines. So, in summary, here in the United States today, we have three really highly effective
Effective.
vaccines. And,
Right.
and that's the way that we are looking at this. And really, my recommendation to the community is that you just take advantage of the vaccines that is offered to you, because again, if you start trying to pick and then say, okay, let me wait for, I don't know, the next day that
Yeah.
X vaccine is available,
Yeah.
stuff like that, like
Yeah.
shopping vaccine. I wouldn't recommend that. Again,
Yeah.
we consider that all three of them are really extraordinary vaccines, and we should take advantage of that.
Right. Right. Great. Okay.
Um, Now, how can we as healthcare workers or nurses help out to get the vaccines in the arms of people?
Well, I think that each one of us healthcare workers have, of course, an individual responsibility of taking care of ourselves, and also social responsibility, helping our community, achieve better outcomes, health related. I believe that for the public, it has more value and actually carries a higher weight when somebody they know, in this case, the healthcare provider or healthcare personnel who happens to be their friend or relative, they actually value the opinion of that person uh,
Mm-hmm.
much more than they value a politician talking about the vaccine or the health district talking about the vaccine. Yes, they will listen to us and they might follow our advice, but they the people that they will follow the most are the people that they know and they are closer to them. So is healthcare personnel has that individual and social responsibility to share with the community the value of the vaccine and why people should be vaccinated.
How true. How true. Thank you for that, Doctor. And by the way, congratulations on being named as the Chief Health Officer for the Southern Nevada Health District. So, what is your goal and vision for the Southern Nevada Health District?
Well, I think we have an immediate goal right now, and that goal is to really have a successful vaccination campaign. And by successful vaccination campaign, I mean for us to achieve a high proportion of our community vaccinated. That's number one, and also together be able to offer the vaccine to our community in in a non-discriminatory basis,
Way,
so
uh-huh.
contribute to health equity and equity in vaccine distribution, and that's something that we are trying to achieve every day,
Mm-hmm.
and a lot of challenges because again, as I have mentioned before in other settings, it's not just about placing a vaccination site at a neighborhood that you consider a high risk or economically depressed. That's not good enough, because even if you place your vaccination site there, and by the way, all our large vaccination sites have been placed on those communities. Still, you have to make sure that people who live in these communities, they have a proper access to that service.
Right.
And what we have seen on the beginning of the vaccination campaign here is that yes, we have a Cashman Center, which is in the middle of a economically depressed area. We have open vaccination sites at several high schools or middle schools in zip codes with a high number of COVID cases, or in the middle of the Hispanic or African American community.
Mm-hmm.
But still, we weren't able to fully engage the community in this area to actually go and get vaccinated. So that's one of the challenges with this. We are working with community-based organizations, representatives of the communities, even the faith community, and multiple groups trying to make sure that we can, make the vaccine available to everybody in this community, and not just to people who are technologically savvy and are able to
Right.
navigate through a
Mm-hmm.
website. So this is one of the biggest challenges that we have, and
Right.
we are doing a lot of things trying to solve it out.
That's great. That's great. Well, thank you for that. And you got a last question, Lisa?
So, Dr. Leguin, what is your message to the public regarding our current COVID pandemic
Yeah.
crisis?
Well, I think that uh, perhaps one of the most important things for the community is that yes, we have a vaccine, and
Mm-hmm.
eventually the vaccine will be available for every person here in Clark County in Nevada. But we have to still do our part. So
Yeah.
even so that we have the vaccine, we still need to keep with all those preventive measures, using the mask to cover ourselves when we are in public, because that even if you are vaccinated, still there is a possibility that you could transmit the disease to people around you.
Mm-hmm.
So keeping the social distance, or the 6 feet distance from one another in public places. Uh, Again, avoiding non-essential travel, at least for now, until we have, I would say, higher levels of vaccination that bring our community and the country uh, close to herd immunity.
Mm-hmm.
And of course, hand washing and other preventive measures that we discuss always regarding flu, but also are applicable to COVID. But again, the most important thing is just don't be complacent, and also even so we're seeing the number of cases decreasing dramatically, we still have to be alert and protect ourselves, our relatives, and people around us from a infection.
Great,
Thank
great.
you.
Thank you. Well, thank you so much, Dr. Leguin, for coming to our podcast today to give us an update on the COVID status of our community. You certainly gave our listeners a lot to think about, a lot of information. So, thank you for enlightening us on the work of the Southern Nevada Health District in handling the pandemic. And if you want to know more about COVID updates, please visit www.southernnevadahealthdistrict.org. Right, Doctor?
Thank you, Doris and Lisa. Thank you.
Yes,
You're
thank
welcome.
you. You're
Thank you,
welcome.
Doctor.
So,
And Lisa, thank you for co hosting today. And congratulations for being elected as the new PNANV president for 2021 to 2023. More power to you. I'm
Thank you
handing
so
you the
much, Doris.
baton.
Thank you for your support. And
Yeah,
PNANV is here, Dr. Leguin, to
to
support
support you.
the goals of the Southern Nevada Health District.
Okay.
thank you, Lisa.
Okay,
Thank
great.
you. Okay.
And to our listeners, we leave you with this. COVID has changed our way of life for certain. There have been many sacrifices, many tears shed for the victims of this pandemic. There has also been many great strides done by the scientists to come up with guidelines on how to handle this pandemic. 3 vaccines for COVID has emerged within a year. Things are definitely looking up. But there's still a lot of unknowns about this virus. Mutations and variances are happening, so now is really not the time to let our guard down. We still need to protect ourselves and protect the people around us. And like Dr. Leguin has said, and it is also the message of the Southern Nevada Health District, and this message is not new, but we know these simple steps. Mask up, back up, or do the social distancing. Wash up, always wash your hands. These are some of the most effective actions that everyone can take to protect yourself and others from COVID-19. And more importantly, schedule yourself for a COVID vaccination. Thank you very much for joining us. This is Doris Bauer, your Philippine NARS host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Philippine NARS, news and features about the Filipino-American nursing community and beyond. Fridays, 7 p.m. on PHLV Radio.